This is called the Patella Apprehension test. To test for like previous dislocation of a patella. Pretty sure your patient knows if they've previously dislocated their patella. But the apprehension is both signs of apprehension from you going, no, I don't want to do that test, or you engaging your quads. So in the resting position, all I'm going to do is apply a pressure laterally. And if a person has dislocated, it's like the muscle memory. They're like, nope, not going there again. And they will contract their quads. You're not contracting your quads. There we go. Yeah. Okay, relax. So as soon as I go to push laterally, you're like, nope. And that'll pull it back medially. Because that, that sensation of the previous dislocation. So again, kind of a silly test, but
you'd only pull it lateral, not medium?
Most patellar dislocations are lateral.
Okay.
Yeah.
And that's the patellar apprehension test?
Yes.
Yeah.
There's a shoulder apprehension test too for, again, previous dislocations and stuff like that. But okay, and the last special test before we move into muscle tests is called Nobel's Compression test, which is testing for IT band friction syndrome. So the IT band itself at the knee is most taut when it's directly over the lateral epicondyle, which happens to also be at that 25 to 30 degrees of flexion, which is also the resting position for the knee. When you have IT band friction syndrome, typically people will report experiencing pain on the lateral side of their knee about 10 to 15 minutes into a run. So it's also runner's knee, right? So if a person comes to you cold and you just do this test, you might not get a positive because you haven't irritated that bursa enough or had that snapping over the lateral epicondyle. So if that's something that you suspect, you might ask your patient to bring running shoes, go for a run around the block, 10 to 15 minutes, come back and then perform the test. You'll probably get, more accurate results. So what I'm going to do is I'm going to assist you through a range of motion. So you're going to help me, I'm going to help you.
Sorry, can I ask, is it possible to just use hydrotherapy heat to warm it up, or does it have to be like actually going for
You have to get that snapping back and forth.
Okay.
Yeah. That repetitive motion. So I'm going to start here at 90 degrees. I'm going to use the heel of my hand and apply pressure over the IT band. So I'm increasing the amount of snapping back and forth. So we're going to go into full extension, then back up into 90 degrees of flexion. Okay, so we're going to do this motion. And again, I'm still applying pressure here. And I do this until water spurts out of his mouth. Anything? So you gotta apply pressure, do it a few times, but again, if they have warmed it up by running, then that's when you're gonna get
When you say apply pressure, do you mean like?
I'm using the heel of my hand and I'm pushing in, not in a valgus way, I'm not pulling out here, I'm just applying pressure onto where the bursa is, and I'm counter pressuring with my fingers here.
Okay.
Are you feeling a snapping when you do that?
Not necessarily, but he doesn't necessarily have IT band friction syndrome either.
Yeah, so if they did, maybe
The whole point is that when you're in full extension, the IT band actually sits in front of the lateral epicondyle. Once you get beyond 30 degrees of flexion, it sits behind the lateral epicondyle. So you're getting that motion back and forth over it, but I'm not necessarily feeling a snap there. You might on some people, depending on how kind of taut it is. Try those.